I'm Olivia Fierro. The number of cases of cervical cancer, well, that's down. And because of that, there's been a change in the screening recommendations, how they affect you, what you need to know at 8:15 with Dr. Thompson. Good morning, Arizona. It is one of the leading causes of death for women. It has been. And this morning, there are new guidelines for cervical cancer screenings. Do you need one? We're talking with Dr. Sharon Thompson about some of the new changes coming up. Well, this morning we are going to talk. We're going to talk about something a little personal and important to your health. Time now is 8:09. In your Health Watch this morning, cervical cancer, once the leading cause of cancer death in women, that rate has dropped dramatically, and now the guidelines for screening have changed. So to help us sort this out is Dr. Sharon Thompson of Central Phoenix Obstetrics and Gynecology with what we need to know. So overall, this is some good news, right?
Exactly. It's great news. Cervix cancer screening is a very, very successful screening program. As you mentioned, cervix cancer used to be the #1 reason women died of cancer, and now it's way down on the list because women get screened.
So, and what is the screening? Is it a traditional pap smear?
The screening is we have two modes of screening now. Okay. The traditional pap smear that you're used to, and a test for the virus that we know causes cervix cancer.
Okay.
And that's pretty amazing because about 25 years ago now, I'm dating myself, researchers found that cervix cancer is viral. It's caused by a virus that's sexually transmitted. So now we have the traditional pap smear that looks at cells and a test for the virus. And so the new guidelines are talking about those two tests.
Okay.
So what I want to emphasize that women should continue to get their pap smears. You still have to get a pap smear, although you don't need them as often as you used to.
So not every year?
Not every year. If you've had normal pap smears or you've never had one in your 20s, so from age 21 to 30, every 3 years, and you would get the traditional pap test. The new guidelines are referring to women over 30 who right now are getting the traditional pap test and the HPV test at the same time. That's called co-testing.
Okay.
The new guidelines are saying you can separate those. You can do either the traditional pap or the test for just the virus. And it gives you indications of how many years between those.
And that's assuming that you're not at high risk for, and you're talking about the HPV virus.
The HPV virus. So, and this is only for women who've had normal pap smears. If you've had an abnormal pap smear, then you're in a different category altogether. Your guidelines will be specialized for you by your doctor.
And probably continuing to test annually.
If not more often.
Oh, okay. So how effective has the HPV vaccine been in this big picture as we look at the changing numbers?
The vaccine is actually very, very effective. There have been studies looking at vaccinated populations and looking at how much HPV you're seeing in those populations versus what you expect, and the vaccine is highly effective. The issue with the vaccine is making sure that young people get it.
Okay.
The vaccine is indicated for boys and girls as young as 9 years old because young people respond to a vaccine so much better.
Okay.
So between ages 9 and 26, the vaccine is indicated for boys and girls. And so we want to make sure that parents make sure their kids get vaccinated as part of their routine vaccination schedule.
And that's something that you need multiple shots for?
It's a 2 or 3 vaccine series. Just like our hepatitis B vaccine is a multiple vaccine series.
Cervical cancer, is this one of those that was kind of initially considered to be a silent killer that you would not know, that you wouldn't have a lot of symptoms of, or does it show itself in symptoms?
Early on, women may not have symptoms.
Okay.
Symptoms will appear later on in the disease. So in the developing world, unfortunately, where pap smear screening is not as prevalent, we still see many, many women dying from this cancer every year. So we're fortunate in this country to have screening programs that detect early changes long before cancer and can treat women so they don't get cancer.
And so cervical cancer, is that related to a genetic predisposition to it, or does family history matter in this case, or no, because oftentimes it's viral?
Family history is not as important for cervix cancer because it is viral. Cervix cancer is associated with the human papilloma virus, and which is why researchers and clinicians have been looking at, is the test alone sufficient for the virus? So if we tell you you do not have the virus, your risk for getting cervix cancer is exceedingly low.
Oh, okay,
because it is caused by that virus.
Dr. Thompson, thank you so much. Always confusing, but it's so nice to have you guide us through these.
Screening.
Yes, always better to see your doctor. Dr. Thompson, thank you. Central Phoenix Obstetrics and Gynecology will have her information on AZ Family.